Safety and first aid. Accidents are caused because people are not careful and are usually preventable. Most accidents can be avoided by following certain basic rules of safety. In this chapter, we will discuss some aspects of safety, such as safety related to bicycles, automobiles, water, fire, injuries, and animal bites. Bicycle safety. All of you must be familiar with bicycles. Now, let us look at some rules of bicycle safety.
Make sure that the brakes work well. There is enough air in the tires and all the parts are firmly in place. Always wear a helmet while riding your bicycle. Follow traffic rules if you're riding on the road. Stay away from surfaces covered with sand, gravel, water, or oil because your bicycle may skid or slip over it. Ride in the bicycle lane if there is one.
Fascinating facts. Helmets reduce fatal and serious injuries by up to 45%. Automobile safety.
Some rules of automobile safety are: while riding in a car, always fasten your seat belt. Sit quietly or speak softly. Do not disturb the driver. Do not play the stereo loudly. Do not put your head or your arm out of the window. Look out for traffic while getting down from the vehicle. Always try to get down on the side of the footpath.
Water safety. Take care of the following aspects while swimming or playing near a water body.
Never go near water without an adult watching. Stay away from water bodies such as lakes, pools, and rivers during stormy weather. Take swimming lessons if you do not know swimming. Always have an adult or a buddy keep watch over you while you are swimming. Never dive in shallow water. Follow the instructions posted around a swimming pool. Always wear a life jacket while in a boat and follow crew instructions.
Fire safety. Fire is a very useful tool for man when used properly and with care. However, accidents involving fire may cause a lot of damage and pain. It is better to be very careful and prevent a fire disaster. Precautions to avoid fire.
Never play with candles, matchsticks, or lighters around the house. Do not use cooking gas when you are alone. Do not stand too close to open fires. Do not cook or burst crackers while wearing synthetic clothes.
If caught in a fire, dial 101 to call the fire service. If stuck inside a building on fire, wrap a wet cloth around your mouth and nose to avoid inhaling smoke. Do not use lifts. Leave the building using the staircase or emergency exit. Follow all posted directions for fire exits. If a person's clothes catch fire, do not allow him to run around in panic. Fascinating facts. To put out a small fire, immediately use a fire extinguisher. Remember the password while using the fire extinguisher. Pass stands for pull the pin, aim the nozzle, squeeze the lever, sweep the nozzle. Oxygen is needed for a fire to burn. If a person runs around, he comes in contact with more oxygen and the fire grows. So ask him to stop and drop to the ground. Wrap him in a blanket to cut off the supply of oxygen and roll him on the ground. It will put out the fire. Remember the words stop, drop, and roll. Firefighting techniques. In case the fire is caused by electrical gadget or electricity, never throw water on it as it can cause electrocution. That is, you may get electric shock. Immediately turn off the main switch. Use sand to put out the fire or use a fire extinguisher. In case fire caused by petrol, do not use water to put out the fire caused by petrol because it increases the fire. Petrol, being lighter than water, floats on it and it keeps burning. Fire can be put out by throwing lots of mud and sand. For fire in a building. In case of a major fire, that in a house or building, call the fire brigade immediately. Small fires can be put out by special devices called fire extinguishers. If they are available, they should be used in place of water or sand to extinguish fire. How to put out a fire caused by oil? In the case of a fire caused by oil such as kerosene, petrol, or diesel, use a fire extinguisher or sand to extinguish the fire. Do not use water because oils, being lighter than water, float on top and keep burning. First aid. In spite of all care being taken to avoid accidents, they still do occur.
Often, patients suffering serious injuries are saved because of the immediate help they receive before they can be taken to a hospital. This on the spot immediate medical help is called first aid. Very often, we suffer minor injuries at home, which do not need specialist medical attention. These can be treated at home if we have knowledge of first aid. In previous class, we have learned first aid minor wound, bleeding nose, burns, animal bites, sprain and fracture, cuts and bruises. If a wound is caused by a minor cut or scratch, first wash it with water and then apply an antiseptic cream over it. This will cover the wound and prevent infection by germs. If the wound is deep, press the opening to stop bleeding. In this class, we will study about first aid for snake bite, poisoning, fainting, heat stroke. Snake bites.
Snake bite needs immediate first aid because the poison of a snake moves very fast through the blood and affects the heart and brain, causing death. So we should do the following things in case of a snake bite. Immediately apply a tourniquet above the bite to stop the poisonous blood flow to the heart and brain. This may help to slow down the spread of poison. Take the victim to a doctor as fast as possible. Note: we should take precautions when we visit the areas where snakes are found. Always wear high boots to protect yourself from snake bite. Poisoning.
There are many things in our home which are poisonous. Nail polish, naphthalene balls, detergents, paints, anti-mosquito sprays are the examples of such things. So, remember the following things to prevent any mishaps due to these poisonous things. Keep all medicines locked and beyond the reach of small children. Read the label very carefully before taking any medicine. Destroy all medicines which have crossed their expiry dates. Wash all fruits and vegetables before eating them. They might have been sprayed with harmful insecticides and pesticides. In case of any kind of poisoning, encourage the victim to vomit. Take the victim to a doctor. It is always better to be alert to avoid any mishaps. Keep the emergency phone numbers with you every time so that you can immediately call for help.
Fainting. Fainting is a brief loss of consciousness. It occurs when not enough blood reaches the brain. There are numerous causes of fainting, including prolonged hunger, exhaustion, and prolonged sun exposure. If a person faints, they should rest on their back with their feet slightly elevated. Remove any tight garments and ensure adequate ventilation in the atmosphere. The dizziness should subside after a minute or two. If the unconsciousness persists for more than 2 to 3 minutes, contact a doctor immediately. Heat stroke. Exposure to severe heat and humidity is the cause of heat stroke.
A person suffering from heat stroke loses a significant amount of water and minerals, resulting in dehydration. The individual suffers severe headaches, vertigo, and maybe a very high fever. Important initial treatment for a heat stroke is keeping the body cool. Place the individual in a shaded, cool location. Elevate the individual's feet slightly. Spray cold water over your entire body. Ice packs can be applied to the head, neck, and armpits. To lower a person's body temperature, use a fan. If the patient is aware, administer water or oral rehydration solution ORS. ORS is a solution of salt and sugar dissolved in water. Let's sum up. Accidents often take place when people are careless or in a hurry. The aid or treatment given to the victim before the arrival of the doctor is called first aid. Snake bites must be treated immediately. Always wear a helmet while riding a bicycle. Fasten seatbelt while in car. Fire can be caused by burning matchsticks, firecrackers, electricity, or oils like petrol, diesel, etc. Water should not be used to put out fires caused by electricity or oil.
Life skill. Be safe on roads. Every year, a large number of people die in road accidents as compared to other tragedies. So, organize a talk show to increase the awareness about road safety rules in your locality and do the following things. Tell everyone various safety rules that they should follow while crossing the road. Show them different road signs and tell their meaning so that they can follow proper directions on road. Tell and explain people the importance of life so that they drive sensibly in case a person comes in front of their vehicle by mistake. Meet the scientist. Sushrita was an ancient Indian surgeon and is the author of the book Sushrita Samhita, in which he describes over 300 surgical procedures and 120 surgical instruments and classifies human surgery in 8 categories. He lived, taught, and practiced his art on the banks of Ganges in the area that corresponds to the present-day city of Varanasi in North India. Because of his seminal and numerous contributions to the science and art of surgery, he is also known by the title Father of Surgery.